You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no one should be wearing a loose-fitting denture. With us, we have Missouri's go-to implant dentist, Dr. Grant Olson. Dr. Olson, welcome to the program.
Hey, thanks for having me. Pleasure to be here.
Now, you have a stack of photos.
Yeah.
Probably you're the first guy on the show where we can't even get to all those photos. We'll try, though.
Yeah.
Now, for people that don't know your practice, like, who's the typical dental implant patient you see?
Well, there's really, anybody that's having missing teeth, but there's two main people that we kind of see. We see those that are really struggling with a denture. They've gone through the dental cycle. They've been through all the challenges that repairing and maintaining their teeth has caused. And those people, they come to us because they want fixed teeth. They don't want to have teeth they take in and out. The second group of people, they currently have their teeth, but they've been told that they're going to be in dentures, or they just know that's the path they're heading down. So they're looking for some sort of hope to keep into a fixed set of teeth on implants, and that's why they come to Innovative Dental.
Now, we talked on the phone. You said, like, let's say a denture wearer. They can walk in on the day of the procedure with no teeth, walk out with upper and lower teeth that don't come out.
Absolutely.
In like as little as like 2 or 3 visits?
It's not just 2 visits that they can do that with, but it's also just a few hours on that second visit.
Is that right?
That's right.
Because I asked you in the green room, I said, so you could do this in a day? You said, no, it's hours.
It's hours, yeah. With all the planning and technology and the experience, we're able to make something that used to take many hours, many months, sometimes years to complete. We can do it in one day, and not just one day, but a few hours.
Now, correct me if I'm wrong. I guess how dental implants are typically done is you go to one place that does the surgery, another place that puts the teeth on top, and maybe even get them cleaned elsewhere. You do all that right there.
Right.
Is that right? Is that why you do it so quickly?
Yeah, it's not just why we do it quickly, because the speed of it is great for patients, but we can control things like the aesthetics and the cost and things that maybe, multiple places to pay, right? You're going to have multiple communications and people to trust, and they get to come to our office, trust one team to give them the smile that they're looking for.
Now, you have kind of an over-the-top office.
Well,
it's in fact, I put it on Facebook when I saw this tour, but it is one of the largest offices probably in America. And I've researched the prices, and people need to know I'm not trying to endorse you, but you're substantially less than just about everybody else. Yeah. Is it because you do it all right there? Like your own lab, you're making teeth?
Sure, we're able to reduce costs by doing it all in one place. We're also able to give a very clean experience for people that come from all over the country to trust us with their smile.
In Missouri, are there a lot of people that are either wearing a denture or headed to denture? Like, is it a big problem?
Randy, you wouldn't believe how many people are struggling, and it's because they don't tell everybody. But there's millions of people across this country. I think the latest study I've seen is 40 million people in America, and that might be our best guess, but there might even be more. If you took all of those people and you thought about, coming up next week, I think is college football.
Yeah.
And if you took all the stadiums that these games are going to be played in, and you filled them with the people that are struggling every day.
Like wearing a denture or headed to a denture?
Yeah, wearing a denture, heading into a denture. You wouldn't have enough room to fill all of those stadiums.
So it's a big problem. You say no more dentures. You believe that? Like
Absolutely.
Dentures are a thing like in the future, maybe 20 years. Dentures as we know them today will be gone.
That's now, Randy. Right now we want to create a practice, and we've been working really hard at this to create a place that we can really say no to dentures, and we have options for people from a minimal expense to the full permanent set of teeth.
So how old can you be? Like, what's the upper age range of people that could get implants?
Well, the oldest patient I've worked on is 87.
87? Yeah. Why would an 87-year-old want to do this?
Because they want to live life vibrantly. They want to be able to go out with their grandkids and family and enjoy life, not having to decide to not get that pizza or that steak or whatever food they might love. They don't want to avoid those things. They want to enjoy it.
So when they're, at that age, like 87, 90 years old, are those implants more likely to fall out?
Absolutely not. They're going to be just as likely to be successful as anybody else.
Okay, good. Now, you brought a stack of photos. Now, what are we looking at? These are all people that maybe were headed for a denture. Now they have new upper and lower teeth, supported by implants.
Exactly.
Okay, let's take a look.
Yeah. So the first one I'm going to show you here is one of my favorites. It actually made me realize how much I absolutely fallen in love with this treatment because of what it does for people's lives. I saw a video on Facebook. You sit there and you're scrolling, and you're just it was right before bedtime, and I'm starting to get all choked up. My wife goes, "What are you getting choked up for?" And I was actually watching a video of this gentleman on a boat flying down the lake, holding his daughter in his lap, and she was hitting the horn, and his wife was going again, and they was laughing uncontrollably, right? Just having a great time, living it to the fullest on the lake. And it dawned on me, and this was the weekend after we put his teeth in. So it dawned on me that this guy's living a life that did not exist and would not exist with his dentures at all.
Because the dentures would fly out, possibly.
Yeah, exactly. It'd be in the bottom of the lake, right? So this gentleman is getting to laugh and love his child and just be in the moment. And that's nice. As a father with 2 daughters, that's what kind of got me, right? You know, he's sitting there laughing and loving it, and it was monumental in my experience and understanding of what this does for people.
Now, teeth like this, by the way.
Yeah.
I mean, that's got to be unusual to have teeth that bad.
No, absolutely not. There's people everywhere. You just don't see them smiling, right? They're covering it up. They've learned to talk like this, and so they're reserved, and so they're everywhere. I just want to help them because I think that they're kind of shunned. You know, yeah. His option would have been a denture. I mean, his teeth are in pretty bad shape, but not an Innovative Dental. We wanted to help him out, so we're able to use implants.
Wow,
it's amazing, right? Just a different person. Vibrant, excited. His wife even told us that he's just more annoying now because he's more confident. So I thought that was great. She's just saying that, and that's another interesting fact is that the family members, they really notice this change, and it's not their teeth. It's their personality.
Okay.
It's their energy every day. It's quite honestly, it's even their health, and so they can see them being more energetic, waking up every morning with more excitement for life. So that's what implants can do for people. So look at the before and after here. Would you say that he looks more handsome?
Yes, for sure.
Does he look like he's loving life better?
Yeah.
Right? I'm going to show you a photo.
He even looks more sophisticated, actually.
Right. I got to show you this photo.
Okay.
It's a photo of him chomping on a burger. Right?
Very nice.
There's no way anybody's eating a burger with dentures like that. I mean, they're stacked high, tons of cheese, bacon, burger. I'm getting hungry right now. But,
so what do they like more? Do they like the way it looks, or do they like what they could eat?
It's both. And it's usually they're surprised by one or the other. Usually they go into it saying, I want it to be functional and I want to be able to eat these things like steak, or I want to bite into an apple.
So on something like this, this was done fairly quickly.
Right. A few hours. Yeah. It's hard to believe.
So if somebody, now look, let's say you had a free schedule next week. Somebody watching this with the worst teeth ever, can't save them, or they're wearing a denture.
Right.
They could have their teeth the day after tomorrow.
Yeah.
If they came in today.
Yes.
Really?
Yes, absolutely. They'd have their teeth
that
in
rare?
a few hours. Not at our practice. That might be rare if you're using some older techniques.
So if the patient's in their 70s, what if they're on like blood thinners, osteoporosis medications?
Yeah.
Can they still do it?
Absolutely. Those that can likely walk through the doors of our office are likely to be great candidates for implants. Let me show you this next patient. It's pretty amazing seeing this transformation for her, so I can't wait to show you. But she's struggling with eating, struggling with speech, struggling to obviously smile, didn't have the excitement in her life because she was hiding everything. And we were able to help her by transferring her smile in just a few short hours.
So she would have ended up in a denture as well?
Correct, yeah. She was heading to a denture. Obviously, I mean, struggling for quite some time. This is the story of these patients, right? They have damage to their teeth. And this is not a process that happens overnight. It happens for a long time. They've been struggling with this. So, in one day, we're able to take her and improve her life like that.
Let's take a look.
It's pretty exciting stuff, yeah. So this one you'll notice.
Oh, my goodness.
Yeah, pretty awesome. We're able to give her that with an immediate set of teeth fixed on implants right after we remove those teeth. It's hard to believe.
Now, when they look in the mirror for the first time, what's that like?
Right. It's an incredibly emotional experience. They're really seeing somebody that they've always wished they would see in themselves. And so they're seeing themselves really for the first time for the rest of their life.
Now, you say that like on the consult.
Yeah.
Like, let's say this woman right here. You see that end result.
Absolutely.
Do you ever get like excited? Like you go, boy, they don't know how good this is going to be.
Yeah, I get super thrilled when I see that they're understanding the benefits for them, because I can go, this is going to be a reality, and I can see what their smile is going to look like. Let me show you this guy here. He had a partial, and I know that there's tons of patients that have been struggling for many years with partials. One tooth breaks, add another tooth to it. So it's been a constant battle to try to keep something that's in his mouth that's presentable.
Okay.
He was struggling to speak, struggling to eat, and just really obviously smile. And so came to us to see what we could do because he knew he was heading to dentures, been trying to fix these partials for so long. And one day, just a few hours. Matter of fact, this photo is only 3 days later from the surgery.
Wow.
Obviously trimmed up his hair a little bit, but has an amazing smile. And you'll notice too, we customize these smiles for the patient.
Looks like a different guy.
Yeah. Yeah, absolutely. Totally different guy. These smiles are made to fit the curve of their lips, and they're customized just for them.
You say people with bad teeth are judged.
Absolutely. It's unfair, but it's unfortunate that they are. But yeah, we already know this, that, if in Hollywood, for example, if we want to make somebody look like they're poor or like they are homeless, what do? They take out their
in the
teeth.
movies. Good point.
Yeah, so people are judged unfairly, and it's kind of sad. But the good news is we can help them with that.
How soon can they eat after it's all done, if everything works out?
They can eat immediately.
Is that right?
Absolutely. Okay. Yeah. And would you say this guy looks,
He looks younger.
Younger, right? More enthused for life? Yeah. Would you also say he looks more sophisticated?
It's very nice. You say they all have regrets.
Yeah. Yeah. The biggest regret is they didn't do it sooner. They've given away, this guy's probably spent years in those partials.
So people fly in to see you.
Yeah.
Really?
We're honored to have people come and trust us with their smile from all over the country. And so they find us typically on YouTube. So
You're all over YouTube.
Well, I love connecting with people in any way we can, and that's a great way to do it because we can talk for minutes about dentistry, and they can learn while they're, laying in bed before they go to sleep. And it's an approachable way for people who are, terrified of the dentist. They get to meet somebody and learn about it. So YouTube's been a phenomenal tool for us to connect with people. So I would love to meet more people on virtual consultations, which is what we do to follow up.
Oh, is that right? Okay.
Yeah. So they come and they do like a Zoom call, and we get to connect there and see what we can do for them. What's interesting about this before photo is not that you can see her teeth, but it's that we ask her to smile, and you'll notice that she doesn't, and she won't.
So that's her smile.
That's common. Her option really was dentures, something that's going to sit on the nightstand, come in and out, all the denture adhesive mess that goes along with it. I don't know about you, but I love the taste of food, and you start covering the palate, you lose all of that vibrancy from food, and it's kind of like having a cold. Okay. So don't want to have food that way. We want to have it where we can taste it all. So, but let's show you her end result here.
Wow.
Look at that, beaming ear to ear, super excited to share her smile. That's what's a lot of fun about these after photos. When we go to ask them to smile, you don't have to trigger them to smile bigger. There's nothing, they literally will smile much larger than they did in the before, and you can tell it's because of the way they feel. This gentleman was struggling with periodontal disease, which is a very common issue, gum disease, bone loss. And
that's an infection in the mouth?
Yeah, infection in the mouth that causes the gums to be irritated, causes bone to resorb around teeth. You'd think these people wouldn't be good candidates for implants, but they're one of the best candidates.
So even if your gums are bad, you could do this?
It's amazing. The gums will heal up. They're more likely to have healthy implants than they ever were with teeth.
Okay.
And so it's a phenomenal transformation. Let me show you.
Again, this guy, his option was a denture.
Right. He was literally facing going into dentures. Nothing we could do to fix his teeth, but implants saved his smile.
Do these people want to give you hugs? Or?
It's awesome. Yeah, we get to give a lot of hugs. It's funny. We have one of our assistants. She hates being hugged for whatever reason.
Okay.
But it's great because I know at the end of our treatment, the patient's going to want to hug me. I like hugs. I'll take a hug. And she always is trying to dodge it, but she's a good sport. So
now your office, by the way, we have a little bit of a clip of your office because at the beginning of the show I said this is kind of an over-the-top office, and it probably could be. It's like a resort, right?
Yeah. We created
this is not an exaggeration. It's 29,000 square feet.
Yeah.
You've got a stream. You've got music playing in the parking lot.
Yeah.
It's a big deal.
Well, we created an environment that makes dentistry more approachable. There's a lot of people that don't come to the dentist out of fear, the anxiety of the way things have been done to them in the past. And so we've tried to create a place that people typically want to go to, a resort. And so we do dentistry there, but we make it a comfortable environment.
It's like wide open and big, and you have a stream, and
tons of light comes in.
And you're less. We for people just tuning in, I'm not siding with you, but I know the prices of implant dentistry, especially a full arch of teeth that don't come out, and you're like substantially less.
Yeah, we're very affordable.
It's because you do it all right there.
We do it all right there. It allows us to be affordable, allows us to be precise, not have multiple visits that we didn't need to have, so we'll be able to give patients a great experience.
Now I have to bring this up because we're going to get emails about this, that even the best dental insurance doesn't really cover this. Very small.
Right.
Medicare, Medicaid doesn't cover it at all. So what's the answer?
Yeah, well, people finance it. So we have 8 out of 10 people, 9 out of 10 people probably finance this treatment. They're able to find great options at our practice. We have 3 or 4 different options for them, even with low credit, but we really can help people with any sort of decent credit.
But you do take insurance.
Yeah.
Like you'll try to get every penny out of their
insurance.
insurance.
Absolutely. Might as well. Yeah. We really try to help people get the benefits out of their insurance, and then we help them with the financing.
Okay, good. For people just tuning in, we're talking about implant dentistry, no more dentures, according to my first guest. So I'm going to rush you a little bit because I know you have a stack of photos.
Okay.
So let's take a look at this.
All right, this next patient, she hates the sound of the drills.
Okay.
So avoided going to the dentist. Wants to eat nuts, loves steak, but because of the tooth wear and the damage and the missing teeth, she's heading to dentures. And she already knew that, been told that by another dentist. But she came to Innovative Dental, and we were able to give her a solution that really transformed her life.
Wow.
So now she's eating the steak she wants, the nuts, loving life.
And these are all teeth that don't snap in and snap out.
No.
These are teeth that are
They're fixed.
They're fixed in
they
there.
They
They
are
don't
fixed to
come
the implants. They do not come out.
out. And I mean, that's a dramatic
I love it.
difference.
Yeah.
In this
totally,
person.
totally different. So
Did they ever say, "Hey, Doc, you've changed my life"?
all the time. Yeah, that's what makes this so enjoyable. Is I know that they're not just a new smile, but they're really a living life now to the fullest. All right, this gentleman here just wanted to eat some Doritos again. Wanted to be able to eat the basic foods.
He says this on the console.
Yeah, he's like, I just wants to be able to have a functioning smile, or functioning set of teeth fixed on implants. He knew that he was heading to dentures, didn't want to go down that path at all. So we were able to do this for him, give him a nice set of teeth on implants. But what's great about this, I love this story about this guy. What's great about this is he brags now about how his smile looks so good. Didn't come in for a smile, would have told you he didn't care. But now that's what he's like. Yeah, people love my smile. That makes me feel great. And, good for him for choosing to transform his life.
So with people like this,
Right.
could they bite like using their front teeth like a raw carrot, or you have to be careful with certain things?
No, anything on the menu. That's what's great about this, right? You can go to a restaurant with your friends and family, and no matter where you're at, you open the menu, everything you can eat. Pretty cool.
Yeah. So this performance. I mean, what does he say?
What does he say? I mean, he's one that I called up, and we always do a post-op call. I give him a call, and he's like, "You've transformed my life, Doc. I can't believe how much better I'm doing. I sleep through the night. I feel better. My joints don't ache anymore." I mean, that's the type of stuff that gives you chills. You're like, wow, this guy is totally a different person. And not just him being a different person, but he wanted his wife to be a different person.
Really?
So he and his wife did this together. I think it's the coolest
Who
thing.
went first? Did he?
He went first, yeah.
Okay.
Yeah, he was the guinea pig because she had a lot more fear. So he was going to show her that, hey, this is something that's pretty straightforward. I trust this office to do it right. And so she was able to muster up the courage, and we were able to help her. Now, she had a denture on upper and lower arches. So both her upper and lower teeth were gone. She was wearing this denture for years. Just struggled to enjoy smiling. As you can see in the photo, we were like, smile, smile, smile. We wanted to at least be able to see the dentures. Couldn't even see her dentures. She's got them in there. But now, see what this looks like.
Oh, wow.
Isn't that cool?
Yeah, and it's like what you say. When you look at the before, you get the wrong impression about her.
Right.
And after,
Yes.
it kind of gives you an idea.
Yeah, you draw some pretty poor conclusions that aren't correct about these people. They are excited for life. They're vibrant now. They're going to go, obviously, live life ordering all the foods they love at every restaurant. So there's a pretty nice future for both of them. Especially if you're older and you're retired and you're husband and wife and you want to live life going to your favorite restaurants, traveling, enjoying all this world has to offer now that you're retired.
Now they can eat whatever they want.
Now they can eat whatever they want. They can go to wherever they want to be and smile and enjoy all the fun that they get to have with, especially that food.
Now, with the spouses that do it together, do they do it usually back to back, same day?
We did
Could
this
they?
a week apart.
Okay.
Yeah, that way they could take care of each other.
Well, that's nice.
Yeah.
Okay. Time for a few more, and I'm going to
Yes.
rush you again because I know
All
you
right.
have a bunch of these photos.
Yeah, here's another great patient of ours that, she's the hero in this story because she chose to come transform her life and get her life back. She was dealing with all these broken teeth and decay, really causing a lot of issues.
Would have
with
been
her.
in a denture as well?
Absolutely.
Okay.
Yep. Heading towards a denture. Chose not to go that path. Came to see us, and I love that. Right?
Oh, wow.
She basically that photo is a week apart. It's hard to believe.
And also, I think you said that you're doing this on a computer. Like you're planning these surgeries on a computer.
Right. I would never consider even working on something as important as a smile without really knowing where we're headed.
Okay.
And so with digital planning, we can know what our patient's smile is going to look at before we ever touch them. So pretty incredible.
Can you show them what their teeth are going to look like?
Yeah, we can
when
even
they're
do
there.
simulations. Yeah. Oh yeah.
I mean, don't they want to know what it's going to look like?
Yeah, sometimes they want to know. Yeah. So we can give them a decent idea of what they can expect.
Are they surprised at how teeth make the difference?
You
Because
know-
going into this, by the way, I always think, it's just teeth.
Yeah.
But when you look at these photos, it's more than that, I guess.
Yeah.
It changes their whole appearance.
Yeah, I think that's the thing that really, once they have the transformation happen, it's way different than a simulation because now it's become so real. They can feel the difference and feel the change.
Now, we have a lot of video clips, and if people want to hear from your patients, they can go to your website.
Absolutely. So, we interview our patients. We have a number of interviews that you can hear what they have to say about the experience and how it's transformed their life to have fixed set of teeth, no dentures.
Now, what about pain?
Yeah, so everyone here has had some sort of sedation that we provide them with. We make sure that they're comfortable as possible during the whole procedure. That way, they have a great experience. All right, I've got another great patient. This one traveled from out of state to see us, found us on YouTube, went to yoursmiledestination.com, which is our website, to connect with us, did a virtual consultation, had periodontal disease. His teeth were getting loose, was having trouble eating, knew he was heading to dentures, didn't want to go down that path, reached out to us, and look at him beaming ear to ear here. I love it. This actually was just completed a couple weeks ago, and it's super exciting to see the transformation for him. What you'll notice here too is it's really not a natural smile because he's just not used to these new set of teeth. But what's going to be great is follow up in about 2 or 3 weeks, and all the compliments he's going to get, now he's going to be smiling much more natural and much more at ease. So this lady is deathly scared of going to the dentist. Matter of fact, so much so that when I walked into the room, she is really tearing up and didn't even want to see me. She just said, nothing personal, I'm just terrified of the dentist. And that's what we got when we asked her to smile. It just could not get the emotion out of her. And so it's hard to imagine living like that. We're able to smile. And so putting ourselves in their shoes, it's amazing what this can do for them. You can see why I'm so excited, because that is her after. How cool is that? So now she comes in, she's just, a lovely lady, was before, but now she can share it.
Do they tell you like specific foods that they enjoy eating now that they couldn't eat before?
Sure, it's phenomenal what they can eat now. I mean, they can eat anything on the menu. So you're talking salads, steak, nuts, pizza. I don't know about you, but I love a nice thin crust pizza, tons of toppings.
So chewy things they can't do.
Right.
Before.
Yeah, chewing, absolutely eating everything that they really struggled with before. All right, this next patient struggled with radiation and chemo from cancer. And it was sad because it really deteriorated his teeth, and he was struggling with that for years. Thank God he fought cancer and won, but now he's got to deal with all these broken teeth and the infections in his gums. But he came to us because he's like, I'm not getting a denture. And so we were able to help him out. And now look at his smile.
Oh, wow.
Right?
Do they ever say that? Like they're in the room with you and they say, look, I just do not want a denture.
All the time.
Okay.
Yeah, that's becoming more and more common. People are realizing that the quality of life that they had with their teeth, they can't give that up. And so, they don't want to be like we hear this all the time too. I don't want to be like my grandparents who really struggled with their denture. And, they're aware of implants, but now that we're able to be, more efficient, more cost effective, get better results, this is really changing the industry and the way that we can help people.
Very nice, very nice. Time for a few more.
Yes. All right, this lady came in wanting veneers, wanting a new smile. Aesthetically, that's what she was going for because her teeth were chipping and breaking. Already had many missing teeth in the back that were implants. So she kind of had this implants and some teeth. And because of the solutions and the way we could 3D plan all this, we're able to keep the implants that she already had, remove the teeth that were severely damaged and worn, and give her something that, in my opinion, looks better than veneers. And it's upper lower fixed, very strong, can hold up to chewing. She's not gonna have to worry about veneers that likely would have been chipping or breaking on those very fragile teeth. So better result, great smile for her. This gentleman had a front bridge that had failed and was gonna be looking at doing all these individual implants. I don't know if you knew this, but we don't do individual implants, right?
What do you mean by that?
Well, if you were to place one implant per tooth that's missing, this would be astronomical in cost.
Okay.
Well, we place 4 to 6, sometimes 8 implants, and we don't charge
for full arch of teeth.
Right, and we don't charge per implant at our office. So we're going to do what's best for the patient after we 3D plan this, and based off of the bone levels, we're going to give them the best number of implants for them.
So with this guy, again, his option would have been a denture.
Correct.
And what'd you do?
Yeah. All right, here you go. You can see.
Oh wow.
I'm sharing with the same smile he's got there. That's pretty incredible. He's grinning ear to ear, loving his new life with a new smile.
Now, what about people that have been wearing a denture for like 15 years.
Yeah.
Isn't it true you don't have enough bone to do this?
You know, we used to think that based off because we didn't have technology to see below the gums and see how much bone was there. But now that we can see all of this and we can 3D plan all of it, we're able to help way more people. So
Have you ever had to turn somebody away because you're saying, hey, you don't have enough bone?
extremely rare. Extremely rare to not be able to help somebody. All right, this next gentleman, he had extreme wear, which is actually a lot more common than you think. He wasn't missing many teeth. He just broken them down and worn them down. You know, a lot of people grind their teeth and clench at night, and he had worn them down so badly that there really wasn't much we could do with the remaining teeth, right? We couldn't build them back and have them last. So rather than do something that would have lasted months, we did something that's going to last decades. And we took out those teeth and gave him an awesome smile.
That's a good looking
implants,
smile.
right? It changed his face. That's what's crazy about it. Because when you wear down
He's
your,
like more handsome for sure.
when you
right?
wear down your teeth, your whole face closes, right? Your nose and your chin get closer together.
Is that right?
Right. So
Okay.
it changes the whole face. And so we gave him back the height that he had in his face, where he was probably when he was 20.
We literally are out of time.
I know. I hate
one
that.
more.
I hate
more.
that. But yeah, well, I got one more for you. So thanks for letting me finish that one up. But this is an amazing patient that came in, going to be missing teeth, tons of missing teeth, and going to be in dentures. And we were able to help him with an amazing smile. Check this out.
Looks good. Looks very
Ready
nice.
to go to his Springfield Cardinals game there that night. So
Final message. We're out of time. Somebody watching this, there are the two groups of people.
Yeah.
The one group where they have really bad teeth and they're going to end up in a denture, or they're currently wearing a denture. Let's say they've heard what you have to say,
yeah.
but they're still skeptical, or
Right.
maybe they're afraid. What do you say to them?
It's understanding to be skeptical and be afraid. And there's probably many other reasons that people are not going to come into a dental office. But there's one really great reason.
Okay.
And that's that the quality of life that you can have with your smile is so worth you seeing at least what your options are. We do free consultations at our office just so we can get to meet you.
Do they get to meet you most
Of
of the
course,
time?
absolutely. Yeah, we're going to take a 3D X-ray so we know what your bone looks like. We're going to assess your smile. We're going to talk with you about your options so that way you can make an informed decision. And really, you know, you can't live your best life without teeth. It's impossible. And so dentures aren't teeth. They're two pieces of plastic in the mouth. But when we use implants and we put a nice set of teeth on there and you can actually live life fully, that's living. And that's what we want to talk about at Innovative Dental. I know we can help a lot
Very
of
nice. So
people.
you could be 80, 90, even 100 years old
Exactly.
and get this done.
Exactly.
So when you hear a patient that says 70 and I'm too old,
That's prime time.
and what if, and if they're on medications, you'll work with their doctor if you have to.
Of course. Yeah.
Okay. So no more. Well, I want to thank you for coming on the show.
Yeah,
if they
thank
go
you.
to your website, you've got video testimonials,
Correct.
lots of Google positive reviews.
Yeah. I think we're the highest rated Google, reviews in the country. 3,500 positive 5-star reviews.
Okay, good. I want to thank you for coming on the show.
Yeah.
Good job.
Thanks so much. Appreciate
Nice
it.
stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.